How are you?
I'm good. How are you?
I'm okay, although I would have been better if she managed to get the 400 euros, but only for two numbers.
Oh, terrible.
For next time, for next time.
Next time.
So far we have focused on the lower back and even the upper shoulder
Yeah.
and neck.
Yeah.
But in general, and if possible, we can also open our lines, if it is possible. Fil-fatt ħaniftħu l-linji tal-telefons tagħna għalikom kollha illi qegħdin is-seguna sabiex wieħed ikun jista' isaqsi lill-Cairo tagħna dwar kwalunkwe problema illi wieħed jista' jipprova jsib soluzzjoni għaliha wkoll. In general, even from the general feedback that we've got, a lot of people know that our posture is a major cause of our pains.
Yeah.
But could it be that us as Maltese, and we all suffer from some kind of a back pain, could it be that it's because of our genetics?
I think it's genetics doesn't play so much of in certain conditions it can do, but more likely it's your lifestyle that plays more of a factor in
Okay.
back
Ġifieri,
pain, things like that.
minkejja li ħafna jistgħu jġibu l-iskużi u jgħidu għaliex għax ommi kienet bagħti bdara jew għax hija l-ġenetika, fil-verità il-ġenetika ftit tilab fejn jidħol l-uġieħ tad-dar, imma ħafna drabi hija kwistjoni tal-istil ta' ħajja illi wieħed jgħix. But if we take, for example, this X-ray over
Yes,
here,
yes.
what does it say to you?
So this X-ray here is obviously of the shoulder. So this is common in genetics. Don't play so much of a factor in it, but it's more to do with, say, for example, how you use your shoulder and wear and tear and things like that. So often what can happen is people can have calcium deposits in the actual tendon, which can cause pain. So there's many things that you can do to help alleviate
Mela,
things like this.
and on the other hand, if we take, for example, our palm,
Yeah, yeah.
is it an issue of calcium as well or no?
No, this is, so something like this in the palm, I see this often in the clinic, is something called carpal tunnel. I don't know if you heard of it, it's quite common.
I've never heard about
Yeah.
it actually.
So it's very common in people that use their wrists a lot, so working
All
at
right.
computers.
Mela,
and
jekk
things like that.
wieħed jista' jfoka iktar fuq dak li qed jitkellem il-Cairo tagħna, qiegħed jiffoka fuq il-fatt illi xi ħadd li pereżempju juża typing jew inkella juża ħafna
Yeah.
idejh, what happens?
So what happens is, so for example, people that do very intricate work, they can also have the problem. So the nerve which feeds through here is called the median nerve. And what happens is people will get weakness in these 3.5 fingers. So they'll get pain, they'll get tingling, they'll get burning sensation.
But why? Why?
So what happens is because there's a ligament which crosses through here, the carpal, transverse carpal structure here. So that can push on the nerve, the median nerve, and this can cause problems. And what people don't realize is they can actually manage this. If they pick up on it quite early, they can do changes to their habits and they can do stretching exercise. And
Okay,
things
so
like
let me
that.
translate. Let me
Yes,
translate that before going to the next slide. Mela, dawk kollha li b'xi mod ieħor ħafna drabi wieħed igerger bitnemnim fuq is-swaba, l-idejn, eċetera. U r-raġuni tkun minħabba xi prattiċi li aħna nagħmlu li tibda tiġi bħala rutina. Il-kawża tgħidilna l-Cairo huwa li fuq fil-parti hawnhekk ta' idejna għandna tendon u dan il-tendon ikun qiegħed jippressa fuq il-nervituri li allura jinġibdu lura. And what's the solution there?
Ligament.
Because
Sorry,
we
the
can't.
ligament, you said tendon, ligament. Sorry,
It's the ligament, not
Yeah,
the tendon.
yeah,
But then what's the solution? Because we can't stop typing, for
yeah,
example.
so
if
you
our
have to
job-
take loads of breaks from your work and definitely do stretching and warming up. and taking breaks at intervals just to help with that.
Il-soluzzjoni hija li wieħed ikun qiegħed jagħmel l-stretching issa ħafna jdu hemm xi atleti. Wieħed irid jistreċċja mhux għax huwa atleta, wieħed irid jistreċċja għax huwa bniedem. U allura wieħed irid jieħu ħsieb iħaddem il-muskolatura u anke n-nervituri skont ix-xogħol illi għandu. Over here we have the shoulder impingement syndrome, which I never heard about.
Yeah, so this is very interesting as well. So it can happen in people that, for example, many people in Malta swim, because obviously there's lovely beaches here. So this is often occurs in swimmers or people that do overhead work, so people that throw balls and things like that. So what happens is the muscle that passes through here, underneath the structure of the in the scapula, this can get impinged, and this can cause pain down the arm. So this is a very common sort of
komuni wkoll kif stajna naraw meta wieħed joqros il-nerv mill-ispalla l-isfel u hemmhekk jibda dan it-tnemmim ukoll. Huwa regolari għal min jom ħafna jew inkella jagħmel xi xogħol illi litteralment tista' sempliċement tkun qed tonxor, pereżempju, u jiġrilek hekk. And then what kind of treatment do you suggest?
So for this you can also do conservative treatment. You can do myofascial release. You can work on the muscles. You can do stretching. It's very conservative care and it can make a difference to people.
Wieħed jista' ikun jagħtiħu ħsieb bil-mod kif spjega billi jitratta mod regolari ovvjament għand il-Cairo, imma mbagħad mill-banda l-oħra tittoqgħod iktar lura milli tagħmel ċertu xogħlijiet. Tagħti żmien illi n-nerv jerġa' ikun b'saħħtu. Another common cause is tennis elbow.
Tennis elbow, yes, of course. So that occurs more on the lateral side. So the technical term for tennis elbow is lateral epicondylitis. So what happens
That's difficult
is,
for me.
Yeah. So what can happen is the muscles that attach here on this side, they can become inflamed because of the constant use of this side of the arm.
So it's like overworking your elbow.
Yeah, exactly. So anything that, any kind of movement that you're repetitively using, that can cause, injuries to people. So again, you definitely have to be aware of what you're doing and warm up before you do take part in such activities.
So in a nutshell, out of all these common pains, one can avoid them, literally.
Yes, I mean, obviously, if you're something like a professional tennis player, then it's harder because you need to use your elbow. But you can conservatively, usually, take care of the pain symptoms by just, taking care of yourself, warming up, and things like that.
Sakemm xi ħadd mhuwiex xi atleta professjonali li jipprattika l-sport li kif semmejna differenti u allura jisu m'għandux way out. Mill-banda l-oħra dawk kollha li jieħdu l-ħajja easy, l-ħajja ta' kuljum, tista' tevita dan kollu billi tieħossib tagħmel l-stretching u l-warming up qabel kwalunkwe attività li se tkun ħatamel. Mhux bil-fors ħad ikkompeti, tista' anke sempliċement ħad tibda x-xogħol tiegħek id-dar. U dan kollu jevitalek milli jkollok dan l-aktar uġieħ komuni illi ittekiljajna hawnhekk flimkien ma' Dr. Rayasat. Thanks a lot for the information. Hopefully it won't stop on deaf ears and we'll see